and it is my distinct honor to introduce Milena Zivkovic, a remarkable scholar whose contributions to the field of physics and radiation science have left an indelible mark. Born on September 1st, 1995 in Kragujevich, Serbia, Milena's academic journey has been nothing short of exceptional. During her undergraduate studies, Milena achieved an outstanding 9.49 GPA, consistently earning recognition as a top-performing student at the Faculty of Sciences and Mathematics for an impressive 4 consecutive years. Her unwavering commitment to excellence has propelled her to new heights. Currently, Milena is pursuing post-graduation studies with a specialization in physics and maintaining an impressive average grade of 9.67. Her dedication to advancing the field is palpable, evident through her extensive publication record and active involvement in research projects. Notably, she is a key contributor to the Ministry of Education funded project titled Experimental and Theoretical Research in Radiation Physics and Radio Ecology. Beyond her academic achievements, Milena serves as an editor for the esteemed journal Imaging and Radiation Research and contributes her expertise as a reviewer for radiation science and technology. Her impact extends further as one of the authors of the monograph, Application of Monte Carlo Programs and Phantoms in Dosimetry. Through this work, she showcases her profound understanding of dosimetry, cementing her reputation as a prominent figure in the realms of physics and radiation science. Please join me in welcoming Milena Zivkovic, a beacon of knowledge, dedication, and scholarly excellency, to our webinar today.
Thank you very much. Good afternoon, everyone. Do you hear me?
Yes, we can.
Okay, before I start, I would like to say one big thanks for Kieran's organization and opportunity to be here with you today. So please tell me, do you see my presentation?
Yes, we can view that.
Okay. My area of expertise is radiation physics, and I've used a program that can determine cell dose, the dose in cells. However, I currently work manually, so idea is to use AI to help me with this. I will show you practically how it looks like. And as you can see on the title, idea is to optimize the parameters for FOTELP-VOX program. We wanted, to AI to find the most suitable parameters for our simulation. So I need to say that there is a possibility that our algorithm will enter clinical practice, so we can stand near the AAA algorithm for Eclipse systems. It's a system for planning system for radiotherapy. Well, as you all know, the artificial intelligence has its potential to be applied in radiation oncology, and it was found that the prevention of errors is most effective when data transfer processes were automated and operational decisions were based on logical or learned evaluation by the system. What that means? It means that if we have, for example, 200 or 300 patients with breast cancer, we can teach AI to recognize the tumor cells, or with the CT scans, it can really easily recognize the tumor, and it can deliver a dose. We need to be sure that the healthy tissue remains healthy. It can also improve the efficiency and the accuracy of all the operations in the treatment system. First of all, I would like to introduce our software. It's FOTELP and FOTELP-VOX. FOTELP-VOX is only a modification of FOTELP, which works with VOX cells and CT scans. but FOTELP is a general purpose code which use Monte Carlo technique to for tracking the particles. It can be used in dosimetry. It can be used to find the energy that is absorbed in the body parts. It can also be used in radiotherapy as well and radiation damage objects assessments. So this program works in geometry of 3D, and it has a parallelepiped which can be used in different geometries. As you can see, the field of particles can be from the energy ranging from 1 keV to 1000 eV. And we use the probability of particle change from the last to the coming state of phase. So it prepares, like we have an input and we prepare the FabDat program. You can see in the simulation, I will show you how our program works. And after that, it is all prepared for the final FOTELP program. We wrote that in Fortran language, and now we translated FOTELP-VOX in Python, and it seems easier to work with Python because Python has a large bibliothèque for DICOM images. So I think I would prefer Python rather than Fortran, even though we all know that Fortran is very good for numerical simulations. And after this, the particles created are treated according to the model, and we use the same physics and in physics in Penelope code. Those who work with like MCNP, Penelope, Giant, and so on, it's the same physics beyond the program. But if you ask me why our program is different than the great MCNP, is because when we work on MCNP, we need like so many processors to do the simulation. If you have 10 on 8 like billion electrons or photons, and here the simulation is done in maybe 6 or 8 minutes, because we use virtual voxel, and that virtual voxel can replace all of the voxels in one CT scan. So that's the reason that we save so much memory. As I mentioned, we modified this FOTELP-VOX, this FOTELP program, and we got the FOTELP-VOX program, and we simulated the particle transport and interactions in radiation therapy. It's traditional methodology where one person adjusts the parameters for input, and that's why we need AI to help us maybe even tell us where is the range of that parallelogram. I will definitely need to show you right away how the program looks like. So here is the interface, and give me a second to go to program. Do you see the interface of the program? This is the interface of our application. The code the code is in this AVOXMAT, FabDat, and FOTELP-VOX Monte Carlo simulation. It's just visual in Delphi. When you click start, you will start the simulation. The user can open a DICOM image from some patient, and after that you can go through slides, and you see the green outline. It's the place where you can set the parameters for the input. So you put the first slice, last slice, left, right, x coordinate, top and bottom y coordinate, and if you move this green outline, the coordinates will accordingly change in the body frame. And also with this tool, I can put the center of my the center of the tumor. So you also can change the beam geometry. It can be circle or rectangle, and you can also change the radius of the beam. This CT scan on the slide is just an example, because as you can see, it's too much to have like 5 millimeters of depth of the CT scan. So we have a newer one, but just for example. You can also adjust, like if you want to do with photons or electrons. I mean, we can adjust to put a protons, like proton therapy is very, very common in the world. But here in Serbia, we don't have a clinical center with the proton therapy. So I didn't put here in my simulation, because I cannot have a CT scan from proton therapy. You can see you can change the beam direction and center of the tumor and so on. Like you can also change these parameters, and when you're all done, you can click on to start CT data conversion with Hounsfield numbers and cross-section interaction probabilities, FOTELP-VOX, and after that you will have a tumor dose. It's for users. It's an interface for users. When you will have like just a number, the dose in MEV or gray, whatever you like. But we would like to have to see the output from this simulation, and we also made a program in Python to calculate the dose in the tumor and calculate the dose in the tissues around the organ that has like cancer. So what's the problem here? The problem here is that user can do this, but user can also do this. User can do this, user can do this, and so on and so on. And there are so many ways. And you will ask me, okay, so which one of these examples are the more suitable to cure the cancer? So there's a place for AI to find a most positive income of this radiation. And just let back to the presentation. And the main problem is finding these input parameters. And when you're done with the simulation, you can adjust the dose in those slides, and there's just a palette in Vox view. So the different color is represents a different dose in some organs. We use, for example, the melanoma of the eye. There is an input parameters, and it's located in the bottom of the eye. So we created a therapy plan by FOTELP-VOX software by the mean energy of 10 MEVs, and so on and so on and so on. So we did a therapy plan. And how I did this, I got the mean tumor dose, and I adjust the input parameters, as you can see in my application. And it took time. It took time to find, for example, 60 grays as they got in a clinical center. So it took me like maybe 2 or 3 days to adjust all of these input parameters, and it is so easier to use AI in this situation. because we need to get as similar as possible to VMAT technique, because VMAT is commonly used for melanoma in the clinical center. And here's results by FOTELP-VOX. I mean, when person manually set the input data. And I can tell you that with AI, when you have melanoma, when you have CT scan and you can see the tumor, we can calculate the mean dose, we can calculate the maximum dose, and we also can calculate a dose in every voxel. And what will be the best scenario? The best scenario will be if you have, like, for example, if you see on this slide, like, I will round and say 60 grays for mean dose in melanoma. And the best possible case is if you have in every voxel of this melanoma 60 grays. But that's not possible with AAA algorithm. So in one voxel you have 58, in one voxel you have 17, one voxel you have 62, and so on. So the mean dose is 60, and the best possible way for this melanoma is if you have in every voxel 60 grays. So we've got by FOTELP-VOX, by doing with when one person are putting parameters by their own, 62.5. And you can see that for some things there is some greater values or the less values. And also I need to say that even if I adjust the parameters, we meet the clinical requirements. So our program is good, but it also can be better by using AI. So on this picture is just a standard dose volume histogram. It can be used to evaluate the clinical treatment plan. This is for this case, for the melanoma of the eye. And you can also see the organs on the head who got the dose from these from accelerator, from curing this patient. So let me speak now a little bit about AI in this process, on this example or any other examples. It can focus on maximizing the tumor efficiency, but minimizing the risk to those organs that are organs at risk near the organ who is getting treatment. It also can be really used on this program, because as I told you, if we did a good job, this algorithm can be meet the requirements of the clinical practice. It can easily enter the clinical practice. We used bias optimization and genetic algorithms, and the results were better if we used the genetic algorithms as the main tools to adjust, to optimize the parameters, input parameters. And it can also improve the strategies for this problem. It is also very interesting about the results. We got, of course, a better results than when we adjust the parameters on our own. But I also need to say that genetic algorithm was better in this case. It easily identifies the tumor coordinates. It's also what was really interesting is that It save us time so many times, and it also can choose which is the most suitable particle type. So when if we continue to on this topic, to research this topic, maybe maybe we can make we can make a software, an algorithm that can, if you put a patient and put a CT data, it can choose: do you want a brachytherapy, do you want a gamma knife, do you want a what type of therapy is the best for this case, what type of particles is best for this case, to minimize the dose in organs at risk, to increase the dose in the tumor. So it would be very useful for a patient. So if you are in a clinical center, you cannot experiment. But with this software, you can experiment and find a best solution for this patient and for the melanoma tumor they have. So it's also very important because you don't have two same persons, two same tumors, and so on. You need to track all of these parameters as a general health, as a position of the tumor, and everything. So I think it would be very useful to use AI in this process to find the best solution for every patient. Okay, that will be it. Thank you so much for your attention. Do you have any questions?
Thank you, Milena, for the great presentation.
Thank you.